Assalamualaikum warahmatullahi wabarakatuh. My name is Asma Salsabila from class 3B, and in this video I'll give an explanation about COVID-19 is a pandemic for my middle test assignment. Before we go into the explanation about it, we have to know what is pandemic. Pandemic is an epidemic occurring on a scale that crosses international boundaries, usually affecting people on a worldwide scale. A disease or condition is not a pandemic merely because it is widespread or kills many people. It must also be infectious. For instance, cancer is responsible for many deaths but is not considered as pandemic because the disease is not contagious or easily transmittable and not even simply infectious. The World Health Organization or WHO declared COVID-19 to be a pandemic when it became clear that the illness was severe and it was spreading quickly over a wide area. COVID-19 pandemic, also known as the coronavirus pandemic, is an ongoing global pandemic of coronavirus disease 2019 or COVID-19 caused by severe acute respiratory syndrome coronavirus 2. This virus was first identified in the Chinese city of Wuhan in December 2019. A lockdown in Wuhan and other cities in surrounding Hubei failed to contain the outbreak, and it quickly spread to other parts of mainland China and around the world. The World Health Organization declared a public health emergency of international concern on 30 January 2020 and a pandemic on 11 March 2020. Multiple variants of the virus have emerged and become dominant in many countries since 2021, with the Alpha, Beta, Gamma, and Delta variants being the most virulent. As of 18 November 2021, more than 255 million cases and 5.12 million deaths have been confirmed, making this pandemic one of the deadliest in history. COVID-19 symptoms range from known to life-threatening. Severe illness is more likely in elderly patients and those with certain underlying medical conditions. Official deaths from COVID-19 generally refer to people who died after testing positive according to protocols. These counts may ignore deaths of people who die without having been tested. The first confirmed death was in Wuhan on 9 January 2020. Nevertheless, the first reported death outside of China occurred on 1 February 2020 in the Philippines, and the first reported death outside Asia was in the United States on 6 February 2020. More than 95% of the people who contract COVID-19 recover. Otherwise, the time between symptoms onset and death usually range from 6 to 41 days, typically about 14 days. As of 20 November 2021, more than 5.14 million deaths have been attributed to COVID-19. The strongest risk factors for severe COVID-19 illness are obesity, complications of diabetes, and anxiety disorders. Symptoms of COVID-19 are variable, ranging from mild symptoms to severe illness. Common symptoms include headache, loss of smell and taste, nasal congestion and runny nose, cough, muscle pain, sore throat, fever, diarrhea, and breathing difficulties. People with the same infection may have different symptoms and their symptoms may change over time. Transmission of COVID-19 occurs when people breathe in air contaminated by droplets and small airborne particles. The risk of breathing this in is highest when people are in close proximity, but the virus can transmit over longer distances, particularly indoors and in poorly ventilated areas. Transmission can also occur rarely via contaminated surfaces or fluids. People remain contagious for up to 20 days and can spread the virus even if they don't develop symptoms. Preventive measures to reduce the chance of infection include getting vaccinated, staying at home, wearing a mask in public, avoiding crowded places, keeping distance from others, ventilating indoor space, managing potential exposure durations, washing hands with soap and water often and for at least 20 seconds, practicing good respiratory hygiene, and avoiding touching the eyes, nose, or mouth with unwashed hands. Several vaccines have been approved and distributed in various countries, which have initiated mass vaccination campaigns since December 2020. As of mid-August 2021, more than 4.6 billion doses of COVID-19 vaccines have been administered in over 190 countries worldwide. The Oxford AstraZeneca vaccine is the most widely used around the globe. COVID-19 pandemic shook the world's economy, with especially severe economic damage in the United States, Europe, and Latin America. As a result of the pandemic, many countries and regions imposed quarantines, entry bans, or other restrictions, either for citizens, recent travelers to affected areas, or for all travelers. Together with a decreased willingness to travel, this had a negative economic and social impact on the travel sector. Okay, I think that's all what I can say. Wassalamualaikum warahmatullahi wabarakatuh.